And then when you are dealing with children or like youth with Lyme's disease, do you see like any presentation of behavioral symptoms? Like, is there any way to like trace that back to if someone or if a child is like acting out or like having a lot of like learning disabilities and things of that nature?
Yeah.
Does that correlate?
Yeah, so I don't typically work with a lot of children. I mostly work with adults, but there could definitely be behavioral things that will manifest because of the bacteria. Bartonella specifically, things like rage, anger can be symptoms of that bacteria. There's even potentially a link between autism and Lyme disease. So basically anything that's going on in the brain, there could be an infection there. So even like, this isn't really with children, but like Alzheimer's, like dementia, things like that, there's a link that it could be Lyme. So it's something that, you know, people might overlook. You might get a diagnosis, but it could be something that's actually treatable if it's an infection in the brain.
Okay. So is Lyme's disease treatable? Like, can you rid yourself of it completely?
I think so.
Okay.
So not everybody thinks so. A lot of people say that you can just get into remission. I reject that because your immune system responds to things like fear. And if you are just living in fear that this infection is going to come back, then that's really bad for your immune system.
Yeah.
So I believe that I had Lyme disease myself, and I believe that I fully eradicated it. I have other clients who are now testing negative. Like I said, the testing isn't 100% accurate. So really you can't prove it either way that it's fully gone or that it's not going to come back at some point. But I believe that if you build up the foundation of your body and you make it so strong that these pathogens just can't live there, then they won't come back. They just won't be able to live in that environment.
Yeah. Very cool.
Yeah.
That's awesome. Genetics. So I know you said you can pass it through placenta. Would you say that Lyme's disease, though, is genetic? Because I know, like for reference, Jessica's mother has it and her son has it. So would you, I don't know how to ask this because I'm not scientifically.
Well, I know what you're, yeah.
You know what I'm saying?
I know
like,
what you're.
Like, is it likely that her son's children are going to have it, or is there a way to like stop it and kind of stop the genetic flow?
So it's not genetic, but there are some things in your genetics that may make you more predisposed to be sick from it.
Okay.
Well, so first of all, like it's some people are born with it because they did get it passed down from their mother. So it's not a genetic thing, but it's like the actual infection was passed through the placenta, so they were born with the infection.
Okay.
So if we can eradicate the infection, then we'll stop that cycle of passing it down. But the other piece is there are some mutations that make it harder for your body to detoxify. Like the MTHFR gene mutation is one of the most common ones that I see. And when you have that, you're not able to detoxify. So you're going to have toxins build up in your system, like maybe from chemicals and heavy metals and mold and other things. And that's going to make it more likely that the Lyme bacteria is going to flourish. So I think if you don't have any genetic issues, you're more likely to just clear the bacteria and never really have an issue from Lyme. But I commonly see people that come to me and they have these other genetic things that make it harder to detox. And I think that's one of the reasons that they're so sick with Lyme.
Yeah. Okay. And then I know that there's like layers of bacteria, essentially, right? Where like if you have Lyme, even if you kind of rid it or like push it out, then you have like the next round of bacteria from something else. Can you kind of explain that to me?
Well, I think what you mean is like there's just more than one bacteria present and we have to deal with everything.
Yeah, and it's kind of like in a step process.
Yeah,
right?
you have to do things in the right order.
Okay.
Well, and there's also like the bacteria itself that causes Lyme can morph into these other forms. So if you treat it with antibiotics, it'll try to hide from the antibiotics, so it'll morph into another form so the antibiotic doesn't recognize it, and that'll make it harder to treat. So there's that aspect of it. But then there's also the co-infections, parasites, mold, things like that. And so typically when we treat, we want to start with the bigger things like the parasites first, because they can harbor the Lyme bacteria and heavy metals and things like that. So we want to clear out those things. If we just treat the Lyme and we don't address parasites, then the parasites are still going to be harboring Lyme, so we're still going to have to treat Lyme again, basically.
Okay.
So there's a way to do things where it's more efficient.
How can people do their best to prevent getting Lyme if they're not currently a carrier, but it is, summer, people are going outside, people are perhaps in the woods more, camping, whatever it is.
Yeah.
What are like the best preventative measurements to take?
I would say tick checks would be like the simplest thing, just to check your body. Just remembering ticks are very small, but if you like tuck your pants into your socks and make sure that you do tick checks after you spend time outside, you can use, I prefer to use more like natural tick repellents with essential oils and things like that.
Okay.
But really just doing the tick checks, and then just being very diligent. Like if you do notice like that you have any symptoms like a high fever, headaches, fatigue, like something that like a quick onset of something, if that happens like right after you've been hiking, just to have it on your radar. And make sure that you're looking to see if there is a rash and that kind of thing.
Okay, very cool. And how can people find you?
So lymesupport.com is my website. I'm also active on Facebook, so they can find me there. I'm under my nickname Tina, so Tina Arseneau.
Tina Arseneau.